to the virus outbreak in South Australia, an extraordinary reaction today. You would have thought that South Australia was right on top of this outbreak, given today's figures.
Today we have 2 new cases. Both are linked to the Parafield cluster. So to date, there are 22 cases linked to that cluster. So
just 2 new cases today, just 22 infections in all, and almost all in one extended family in the distant northern suburbs of Adelaide. Yet, to deal with that, the government today announced a total lockdown of the whole state, from Cook near the West Australian border out in the Nullarbor to Renmark on the Murray near the Victorian border, or from the mines of Cooperpedia or even further north, Oodnadatta, right down to Mount Gambier. What, 1,300, 1,400 kilometres to the south. All in lockdown, a full lockdown for 6 days because one family in Parafield is sick.
Things that are being closed or shut down effective midnight tonight. All schools, except for children of essential workers and vulnerable children. Takeaway food will be shut. Universities will be closed. Pubs, cafes, coffee shops and food courts will be closed. Elective surgery, except for urgent operations and cancer treatment, will be closed. We are closing open inspections and auctions for real estate. We're also closing all outdoor sport or physical activity. The message is stay at home unless you are accessing essential services or you are an essential worker. Exercise will not be permitted outside of the home for a 6-day period.
It seems an extraordinary overreaction. Shutting down some suburbs I can get, contact tracing and enforced quarantine, sure, I mean that should actually be enough. But it seems that the South Australian Premier and the Chief Public Health Officer are spooked. They don't want to end up like Victoria, locked down for months on end.
I'm asking you to rise to the challenge again. As of midnight tonight, we need our community to pause for 6 days. A series of wide-ranging restrictions will be implemented to significantly reduce mobility in the community, to stop this spread, to stamp out this virus. This is about South Australia pausing so that we stay ahead of the virus. Our concern is that if we don't have this circuit breaker, that we will not stay ahead of this. There is no second chance to stop a second wave.
Now, there is another politician who thinks, like so many premiers, having people sick on their watch, he'll never be forgiven that. But driving them broke, that's okay. Maybe you can throw another few $1 billion of taxpayer money at it later, make them feel a little bit better. Meanwhile, you've got states like New South Wales, which have dealt with far worse outbreaks without shutting down. They're left protesting today that there is another way. But who in South Australia is listening to good sense?
We can't be in a position in our country for years on years that we simply shut down our economies. I think in South Australia, correct me if I'm wrong, but I think there's only 2 new cases. And it's not for me to be providing advice to South Australians, but I think as a nation, we've really got to open up and have we've invested in our health systems and work together in a way that keeps people in work.
Now, I believe with a number of health experts that this outbreak is not going to get way out of hand, and not just because of the shutdown. But at the moment, there are shades of Victoria in this. And there's going to have to be an accounting. How did this virus get out of a quarantine hotel? And now this massive overreaction. Pure Victoria, this. As I said on Monday, our quarantine hotels are now our greatest point of weakness. This is the place where the virus is most likely to be and to get away. The outbreak in Victoria, quarantine hotel, 800 people dead. Virus escaped from that hotel. This one, another quarantine hotel. Virus escaped again. And the virus makes these quarantine hotels so risky because it comes from returning travellers. They bring the virus in from overseas. And outside Victoria, that's the most common means of infection. You get it overseas, you bring the virus to Australia. You're in your quarantine hotels, that is our maximum point of danger. particularly while the virus is rampaging through the rest of the world, and we want to bring these thousands, tens of thousands of Australians who want to come home, we want to bring them home. We have to bring them home. So these hotels have to be as tight as a drum. So as I said on Monday, how can it be that workers of these hotels, like the cleaning woman in this case, they're not routinely tested every week? When this is a virus that you can have and you can transmit without even knowing you're sick. So I could not believe it on Monday when I heard that not a single state in the country does that routine weekly testing of staff at quarantine hotels. I said it was insane. Well, I do bring you some good news. Today, that's changed. Around the country, mandatory testing now of that staff is coming in.
From now, all states and territories have agreed that anyone with quarantine facilities, anyone working in those quarantine facilities will be tested at least weekly to make sure that we increase that surveillance in that area. That's our major risk now of reintroduction of COVID-19 into Australia, as we've seen in Adelaide over recent days.
Look, I know these guys are the experts. I know they're trying their best. But when I hear people say, oh, just trust the experts, you know, what do you know? Seriously, that this testing is only done now? I'll say it again. The quarantine hotels, now our biggest danger. Take no chances. Take no shortcuts. How hard is that?